Hi, today we're going to talk about the lower limb. We're going to divide this area up into muscles that move the femur, and these muscles are located in an anterior compartment, a medial compartment, and a posterior compartment. Another group would be the muscles that move the foot and the toes. That would include this anterior compartment, the lateral compartment, and a posterior compartment. So let's start with muscles that move the femur. We'll talk about posterior muscles, and we'll discuss the gluteus muscles that will include the gluteus maximus, the gluteus medius, gluteus minimus. Deep to this would be the piriformis and the tensor fascia lata laterally. The anterior group are considered the hip flexors. We'll talk about the iliacus and the psoas. So let's talk about muscles that move the femur. We'll start with the iliacus muscle. The iliacus muscle sits in the iliac fossa. It inserts into the lesser trochanter of the femur, and it's a major hip flexor. The psoas muscles include the psoas major muscle, which is the one in the back, and the psoas minor. This one's going to originate along the lumbar vertebra and insert into the lesser trochanter of the femur. This is a major hip flexor. This ligament here is called the inguinal ligament. As soon as the iliacus and the psoas travel underneath that, that's what we call the iliopsoas muscle. Laterally is the tensor fascia lata muscle. It originates along the iliac crest and insert into the iliotibial tract, or called the IT band. This muscle primarily is going to be a hip adductor, moving the femur outward away from the midline. The nerve for this is the superior gluteal nerve. The iliotibial band, or IT band, is a connective tissue band that lies along the lateral thigh. Its origin is along the proximal ends of the tensor fascia lata tendon and also the gluteus maximus muscle. It's going to insert along the lateral epicondyle of the tibia. This tendon supports the knee in knee extension, which stabilizes the knee in activities such as standing, running, biking, and walking. So let's talk about the gluteal group. There's a gluteus maximus, which is the largest, gluteus medius, which sits below that, and gluteus minimus. The gluteus muscles are most active in 30 degrees of knee flexion. So if you want to build up the gluteus maximus, squatting exercises are good for that. The gluteus maximus origin is along the iliac crest, the sacrum, and the coccyx. It's going to insert along that iliotibial tract and the linea aspera of the femur. The action of the gluteus maximus is in hip extension and also in a little bit of lateral rotation of the hip. The nerve to this is the inferior gluteal nerve. The gluteus medius is underneath this and located superiorly. We can see it right here. The gluteus medius is going to originate along the ilium, and it's going to insert on the greater trochanter of the femur. The action is hip abduction, bringing it out here, and medial rotation of the hip. The nerve to the gluteus medius is the superior gluteal nerve. A good way to remember that is the gluteus maximus is located inferior, and it's innervated by the inferior gluteal nerve, where the gluteus maximus is superior and is innervated by the superior gluteal nerve. Another muscle innervated by that superior gluteal nerve is the tensor fasciae lata. Intramuscular injection sites are done in regions where the muscle is thick and there's very little possibility of injuring a nerve or a vessel. So we use the deltoid muscle, the gluteus medius muscle, not the gluteus maximus. Why would we not want to use the gluteus maximus? It seems like it's a larger muscle. Because the sciatic nerve travels underneath the gluteus maximus, we would not want to do a procedure that could injure that nerve. Another area is the vastus lateralis muscle. This is a common area for EpiPen injections. As we go deeper, the next muscle is called the piriformis muscle. This is going to be easily recognized when we see it on a model or in a cadaver image because it sits right on top of the sciatic nerve. The sciatic nerve is the largest nerve in our body, and it travels posterior to the gluteal region and posterior to the thigh and runs into the lower, the calf and the posterior calf and lateral calf. The origin of the piriformis is along the anterior sacrum. It's going to insert to the greater trochanter of the femur, and it's going to abduct the thigh. So moving into the thigh region, we're going to talk about muscles that act on the femur, tibia, and fibula. We divide these up into a medial compartment. We call those adductors. So the primary function of these medial compartment muscles is bringing the thigh, the two femurs together, or adduction of the thigh and hip joint. The anterior group are considered the extensor compartment because they're primarily responsible for extending the leg or the knee and flexing the hip. The posterior compartment is considered the flexor compartment because they flex the leg or the knee and extend the hip. So let's look at the first group in this, in the anterior compartment. The group is called the quadriceps femoris muscles. There are knee extensors. There's 4 muscles, part of the quadriceps. The first one is the rectus femoris. We consider this a kicking muscle. This is the only quadriceps femoris muscle of the 4 that crosses 2 joints. It's going to originate in the anterior superior iliac spine of the ilium, and it's going to insert in the quadriceps tendon in the tibial tuberosity of the tibia. Because of this, it's going to extend the knee and also flex the hip. The next one is called vastus lateralis. The vastus lateralis also inserts along the quadriceps tendon along with the other quadriceps femoris, so it's primarily a knee extensor. Underneath the rectus femoris, we have the vastus intermedius, also a knee extensor, and the vastus medialis also inserts in the tibial tuberosity, extends the knee. We already talked about the vastus lateralis, located right here laterally to the thigh. This is one of the muscles that is used often for epi injections, for intramuscular injections. So in this anterior compartment, let's talk about the quadriceps femoris, which the first one is the rectus femoris. It originates along the anterior superior iliac spine, and it's going to insert into the quadriceps tendon. Because it crosses the 2 joints, it's going to flex the thigh and extend the knee. The vastus medialis is here in the orange. Again, it's going to originate along the linea aspera of the femur. It's going to insert in the quadriceps tendon along the tibial tuberosity, and it's another knee extensor. The vastus lateralis, it's going to originate along the linea aspera and in the same insertion as the other three muscles. And the vastus intermedius, which sits underneath the rectus femoris, and this is going to originate along the shaft of the femur and insert into the quadriceps tendon. All of these are knee extensors. They're all part of the quadriceps femoris group. Another muscle we see here in this anterior region is the sartorius. The sartorius is not a quadriceps femoris muscle. This muscle originates along the anterior superior iliac spine. It's going to insert along the medial tuberosity of the tibia. And this action is going to flex the knee up and lateral rotate the hip. The nerve to all of these is the femoral nerve. In the posterior compartment, the group is called the hamstring muscles. It includes three muscles. Laterally is the biceps femoris. We always refer to anatomical position. This is a posterior image. So the lateral muscle here is the biceps femoris. There's two heads, the long head and the short head. Medially is the semimembranosus. That's how you're going to remember it. Membranosus with medial. On top of that is the semitendinosus. You can see here in pink. It's medial and superficial. This posterior compartment is responsible for hip extension and knee flexion. Let's look at these in more detail. So the hamstring muscles we consider our standing muscles. The biceps femoris, they're all going to originate along the ischial tuberosity of the ischium. The biceps femoris is going to insert on the fibula because remember it is located laterally. The semimembranosus also originates on the ischial tuberosity, but the semimembranosus, which is medial and underneath it, is going to insert on the posterior tibia, and the semitendinosus sits on top of the membranosus, is going to originate along the ischial tuberosity and insert into the anterior tibia. These insertions form a triangle around the knee joint, which assist in stabilizing this knee joint, especially in flexion. The nerve to this group is the sciatic nerve. The medial compartment is going to include the muscles we're going to focus in are three muscles, even though there are five. We're going to talk about the adductor longus, which is the most anterior muscle. The gracilis is in between, and the adductor magnus is located posteriorly. All of these muscles are going to originate on the pubic bone. The adductor longus is going to insert along the linea aspera of the femur. The gracilis is going to insert along the medial surface of the tibia. And the adductor magnus is also going to insert along the linea aspera of the femur. All three muscles primarily adduct the hip, bringing both femur bones together. The nerve to all of these muscles is the obturator nerve. If you're looking at these either on a cadaver image or on a the model of this region, you will notice that the adductor longus is located anteriorly. The next muscle in order would be the gracilis, and the adductor magnus would be located posteriorly. The way I remember that is that L comes before M in the alphabet, so longus is anterior and magnus is posterior. These two, the adductor longus, adductor brevis, and magnus, they're all obturator nerve, except for the adductor magnus is also innervated by the sciatic nerve because it's located posteriorly. In terms of action, they pretty much adduct the hip, except for the gracilis also flexes the knee. So let's move on down. We'll talk about the muscles that move the foot and the toes. We divide these up in 3 compartments. The anterior compartment includes 3 muscles: the tibialis anterior, extensor hallucis longus, extensor digitorum longus. In this anterior compartment, all these tendons are extensors. Hallucis means the big toe. Digitorum includes the toes from 2 to 5. The lateral compartment are plantar flexion, assisted plantar flexion, which moves your foot down like walking on your toes, and eversion of the foot. There's 2 muscles here called the fibularis longus and fibularis brevis. The posterior compartment is divided into a superficial group, which includes the gastrocnemius and the soleus, and a deep group. The deep group includes the tibialis posterior, and in the posterior compartment, they're flexors. So there's a flexor hallucis longus and a flexor digitorum longus. The superficial group of the gastroc and the soleus unite what we call the calcaneal tendon and insert into the calcaneus. So let's look at these muscles in more detail. In this anterior compartment, we have 3 muscles: the tibialis anterior. You could see it located right here, right on the tibia. The next tendon in order is going to be the extensor hallucis longus. So it's located right here, and you could see it's going to the hallucis, or the big toe, and it extends the big toe. The next tendon in order is the extensor digitorum longus. This extends the digits, or the phalanges of the toes, from 2 to 5. Laterally, we only have 2 muscles. The fibularis longus, in this image it's cut, it's most superficial, and then underneath it would be the fibularis brevis, which you can see in here. So let's talk about that anterior compartment of the foot. It's the tibialis anterior muscle. It's going to originate along the lateral condyle of the tibia, and it's going to insert into the first cuneiform and the first metatarsal. The action on this is foot dorsiflexion. So you can see in this image, dorsiflexion is bringing the foot up. This is the dorsum of the foot. Dorsiflexion is bringing the foot up, or a good way to look at it is walking on your heels. Another action of this tibialis anterior is foot inversion. So foot inversion, it's like your pinky toe moving inward. So inversion is pulling your foot in this direction. So let's go to the next one, the extensor hallucis longus, which is the purple. This is going to originate on the fibula, and it's going to insert on the base of the first phalange, or the big toe. And this is going to extend the big toe. It's going to pull it up forward. The extensor digitorum longus, it's going to originate along the lateral condyle of the tibia. It's going to insert along the phalanges 2 through 5, and it's going to extend the toes. The nerve for this group is the deep fibular nerve. Laterally, we only have 2 muscles. The fibularis longus, it's going to originate on the head of the fibula. It's going to insert into the first cuneiform, And the action on this is plantar flexion. So here's the plantar region of your foot. It's going to pull that down, or walking on your toes. And it's also going to evert the foot. So evert is bringing your pinky toe out. So it's pulling the foot up in this direction. The other muscle underneath the fibularis longus is the fibularis brevis. Similar action, but it inserts into the fifth metatarsal. The nerve to both of these muscles is the superficial fibular nerve. If we look at the tendons around the foot, you can see they're in order. This is a lateral image. Most medial would be the tibialis anterior. The next one would be the extensor hallucis longus. The next one is the extensor digitorum longus. Laterally, we only have two, the fibularis longus superficially, and underneath it would be the fibularis brevis. So if we look at them on the cadaver, here's an image of the cadaver. We'll notice that the tibialis anterior is right up against the tibia. The next tendon in row is the the extensor hallucis longus, going to the big toe to extend it. The next one in order is the extensor digitorum longus, going to the digits 2 through 5. Laterally, we could see the fibularis longus right here, and the fibularis brevis. You could catch a little bit of it out here on the sides. So let's go into the posterior compartment. It's going to include a superficial layer, which we see here, the gastroc muscle. There's a medial head and a lateral head, and underneath it is the soleus muscle. They both unite and insert into the calcaneus via the calcaneal tendon or the Achilles tendon. Deep to this, we have three muscles. One is called the tibialis posterior. The other is the flexor digitorum longus, which is located medially, and then the flexor digitorum, the flexor hallucis longus, located laterally. Flexor hallucis longus will flex the big toe. Flexor digitorum longus will flex the digits from 2 to 5. So let's look at these in more detail. So the most superficial muscle is the gastrocnemius. There's two heads. There's a medial head and a lateral head, and they originate along the medial and lateral condyles of the femur, and it's going to insert into the calcaneus. The movement of this is plantar flexion of the foot, so it's going to pull the foot down in this way, or walking on your toes. The soleus, if we could take this off, and underneath it is the soleus. The soleus has two origins. One is along the fibular head and the other is along the medial tibia. And it's also going to insert into that calcaneal tendon. We consider this a walking muscle versus the gastroc a jumping muscle. And this is associated with plantar flexion, bringing your foot down like this, or walking on your toes. The nerve supply to both these muscles is the tibial nerve. So here's the superficial muscles, the gastroc. Underneath is the soleus, and here's the calcaneal tendon. The deep muscles are the tibialis posterior, flexor hallucis longus, located laterally, and that's going to be important when we're looking at the cadavers or the models. And flexor digitorum longus is located medially in green. So the muscles we've looked at is the tibialis posterior. It's going to originate along the posterior tibia, and it's going to insert into the navicular, cuneiform, cuboid bones, and it's innervated by the tibial nerve. The action is plantar flexion, a little bit of inversion. The flexor digitorum longus is located medially, and it's going to insert on the base of the distal phalanges 2 to 5, and it's going to flex those phalanges. The flexor hallucis longus, it's going to be originate laterally, and it's going to insert into the distal phalanx of the great toe. This is going to flex the great toe. So if we could look at these medial tendons in row, there's a mnemonic called Tom, Dick, and Harry. So Tom, they're in order. We see here the tibialis posterior in orange. Then Dick, flexor digitorum longus in green. And then behind that is Harry, the flexor hallucis longus. And posterior to that is calcaneal tendon. If you add and nervus, Harry, it would also include the tibial artery and the tibial nerve that travels in the same location. So an overview of the muscles we just covered. We could see here the tibialis anterior, all in order. Next would be the extensor hallucis longus, which extends the big toe, and then the extensor digitorum longus, which extends the toes 2 through 5, all located in that anterior compartment. The lateral compartment is the fibularis longus, superficially. Underneath that is the fibularis brevis. Posterior compartment, superficially, we would have the gastrocnemius, and then the soleus underneath it, inserting into that calcaneal tendon. The posterior deep compartment, initially we see the posterior tibialis, which is always located in the center of the other two muscles, and it sits right on the tibia. Then we have the flexor hallucis longus. So if we're looking in anatomical position in the posterior compartment of this lower leg, the flexor hallucis longus is located laterally. You would think it would be located medially because the big toe is located medially. But as you notice here, the flexor hallucis longus crosses underneath the calcaneus to insert into the great toe, which assists in flexing the great toe. The flexor digitorum longus is located medially, and this is going to cross underneath the calcaneus to insert into the 2nd through 5th phalanges to flex those toes. So if we're looking at this on a cadaver, we could see the gastroc muscle here. The soleus is underneath it. You can't really tell it here. It would be these side images here. Deep, we've got tibialis posterior, which you could see is located in the middle and right up against the tibia. And then we have the flexor digitorum longus. So the flexor digitorum longus is located more medially, and then the flexor hallucis longus is located laterally. And we are done.